a nice, neat link to our next speaker, Jaine Keable from Well UK, who will be reflecting on, and somebody needs to switch their mobile phone on. It's not mine. What? It's yours. Both of them switched up. I'll double check in a second. And you'll be reflecting on the research and evaluation of the Southwest Wellbeing Consortium of Healthy Living Centres, and I'm very pleased and delighted that so many of the Southwest Healthy Living Centres are represented here today. So, Jaine Keable, thank you very much. I'm actually now going to check my phone.
Well, I've been asked to talk about Social Enterprise Consortium and to relay some success stories across to you. And I think there's also so much still to understand about how consortiums can work and how they really do bring strength and added value to its partners. I think there's an awful lot of learning still to be had yet by those who haven't engaged in that kind of experience. I'm going to start with an introduction to Well UK because consortium working is what Well UK is about. But I also want to share with you another consortium model that has influenced how Well UK works with its partners. The Southwest Wellbeing Programme has been very key to the shaping of Well UK's approach, and I'm going to talk a little bit about them in a while. So Well UK is a social enterprise consortium. Its focus is upon tackling health and social inequalities. It's not for profit, and it has been set up to promote, preserve the individual identities and values of social purpose organisations that are otherwise at risk of being marginalised by larger programmes that require regional and national coverage. So how did Well UK come about, and what inspired the making of it? In 2007, at a time when change was becoming inevitable, two organisations, West Bank and Upstream, both healthy living centres, were selected to be part of a national piece of work to look at how successful healthy living centres could be nudged that little bit further on to becoming more sustainable, more successful, and share good practice. The work was undertaken by Leaside Regeneration, which in itself was an example of social enterprise and a healthy living centre, and was funded by the Big Lottery as part of their investment in the Healthy Living Centre initiative. The timing was right, and the focus became development of collaborative working to build strength and recognition for social purpose groups. But Upstream and West Bank alone did not have the reach and dynamics required to create the right balance and expertise. And the Devon Association of Councils for Voluntary Service joined to be the third key partner to this new venture. And here was born Well UK. It was set up as a separate company, limited by guarantee, and its purpose was to protect local delivery through collective capacity, facilitate through a consortium approach and joint working the delivery of regional and national initiatives at a local level, and be a focal point by which commissioners could engage with the sector as social enterprises. So a little bit around Well UK's pedigree, because I think it's important that you understand that Well UK's founder partners are actually of this sector. They're organisations that have been developed for this purpose. Its founder partners' backgrounds are of the sector. They understand the sector, they work in the sector, and they know exactly what the difficulties are and the challenges. Oops, and the laptop's coming off. They've also worked hard to do their very best, to be their very best at what they do, and recognise the need to share their good practice. Well UK's founder partners have recognition for their work from the Department of Health, the Social Enterprise Pathfinder Programme, the NHS Live Leader Programme, as well as working with the local authority, Devon County Council, and NHS Devon, providing services. They also have developed GP referral schemes and have managed consortium programmes. So a really good pedigree, well-founded background, well placed to actually support this sector. The work has included the development of toolkits for partnership delivery, including falls prevention, weight management and GP referral pathways. They're all developments that can be delivered by partners locally, regionally and nationally, so very much looking at how things that work well can be cascaded out and can be cascaded through other delivery partners. So this isn't about building their capacity, it's about sharing and building other social groups' capacities. Significant in a different way has been West Bank's management of the Regional Health and Wellbeing Programme, Southwest Wellbeing. Funded by Big Lottery to the tune of 3.9 million, this programme is the only Big Lottery Fund wellbeing programme of 17 across England that has been led by a voluntary sector organisation. A huge opportunity here to demonstrate efficiency and impact that this sector is capable of. So what's Well UK been doing with partners outside of those that founded it? Well UK has been fully operational across the Southwest now for just over 2 years. It has secured new funds for 75 delivery partners to provide services that improve health and well-being in their communities to their communities. I mentioned earlier 2 key pieces of work that have been funded by the Department of Health, falls prevention and weight management, and Alison, I do believe that they are cost-saving services, so I'll get those figures across to you at some point. These initiatives provide funding to partners who work in different target areas, thus sharing the work and providing local delivery. In addition, it has enabled the delivery partners to gain additional skills and new areas of work. We've used our own network links with Devon Association of Community Voluntary Services, Southwest Forum and Funding Southwest to actually work with and identify relevant partners and invite them to be part of the delivery of these services. So Well UK has also taken on the role of the Healthy Living Alliance, extending the networks nationally, and has gained a seat on the NICE PIN group, which is actually about patient representation to the NICE board, and has secured a place on the board of a national consortium, 3SC, really to ensure that our partners are looked after and not left out. We've also worked with organisations who have skills in specific areas to develop toolkits for partner use, such as drink drive awareness, inclusive play activities for disabled and special needs young people, and toolkits that enable effective project planning and costing. While these programmes have tackled specific health needs, Well UK also recognise that people are happier and healthier if they feel greater self-worth and sense of achievement. And so to address this area of work, we looked at engaging on 2 other programmes that became available. Through NIAS, the National Institute of Adult and Continuing Education, we've implemented a programme of informal learning across Devon. Our method of local delivery involved the engagement of 26 social sector groups who delivered taster sessions of their work in local community places. This work benefited a mere 1,900 people, 75% of whom said they wanted to continue with further funding. As a consequence, the delivery partners have secured additional work through this. This work, I must add, was only available for Devon-wide coverage. So the small organisations we actually worked with would not have been able to demonstrate capacity, but as a consortium, we could and we did. So Well UK also seeks opportunities to draw funds through national consortiums. We are not big enough to be able to sit at the top table, so we recognise that there is actually the need for us to be doing that. And through this we're able to cascade opportunities to our partners. So many government initiatives that are coming out are now designed to actually reduce their management overheads. and they're on costs. So they're now looking for very few contracts. They're wanting to make a few contracts with big contractors. If we don't actually manage to secure places with them, we're actually good with the smaller organisations are going to be very much marginalised, and we won't get a look in. So we're now looking at sitting on boards and being part of national organisations who will be securing those funds, and who will also be taking the cash flow risks that come with that. We've had some experience of this through 3SC, where we've secured future jobs fund placements. So Well UK has actually rolled out 126 of those placements for young people. This had its challenges, but the young people concerned have had huge benefits. We've been careful to place these opportunities with partner organisations that offer the right nurturing environment, and that's something that this sector is very, very good at. So far, 77% of those young people completing their 6-month placements have been offered long-term contracts or secured jobs elsewhere, or have gone on to further education, and I think that speaks volumes for the work that those small organisations have done with those young people. We've asked those young people to complete short evaluation forms that actually allows them to express how they felt about themselves and their self-worth and their life's chances before they embarked on their placements, and then again afterwards. And without any doubt at all, they have all said that they have grown in confidence, they've grown in self-belief, and have demonstrated that they have improved social skills and gained new skills for work. So a very successful piece of work, a very unobvious piece of work for health and social care inequalities. For the organisations that provided the placements, of course, this opportunity provided the benefits of an extra pair of hands for free. Something that they weren't able to afford, which is why they kind of jumped at the chance, really. As a result, these employers witnessed increased productivity, and as a consequence of these proven benefits, it meant they were able to offer those posts permanently. The direct impact of that was that they grew the job market by creating new and additional opportunities that would never otherwise have come about. So an actual growth in the job market that would never have happened. They also introduced, some small employers were introduced to new experiences. So for some, they'd never really done many job interviews, they'd not done any appraisals, and they'd never worked with training providers. So a whole range of upskilling that was facilitated for them to get them moving along. So here the clear benefits of consulting working: collective impact, collective strength to secure funds, and centralised management that leaves delivery partners to do what they do best, improving people's health and well-being. But back to the wellbeing programme, is the example I really want to share with you today. It's something close to my heart, and I think has been an extremely successful coming together of organisations to work towards the same agenda. So what is the South West Wellbeing Programme? It's an inspirational model in my book. It consists of 15 partners, 10 of which are healthy living centres, and the rest being social purpose organisations. Each of those partners have their own identity, extensive knowledge and relationship of their community and how to work with their community, and have received £3.9 million of lottery funds to do what they do best, to address improved healthy eating, increased physical activity and low-level mental health issues. The partners have made very clear efforts and commitment to deliver a significant piece of work collectively, for the first time coming together to actually share good practice and break down some of the barriers that might have been there when sometimes pieces of work can create territorial kind of traits. So they came together as a collective body. They were able to articulate and negotiate as a single body and maintain their localism and identity. This had clear benefits for the funder as well with this approach. It enabled a single point of contact, thus eliminating multiple contacts, thereby reducing the cost of management. It produced a new form of governance and management that enabled a wider and more strategic approach. But also it retained local ownership, shared good practice, facilitated local workshops for learning, and collectively resolved problems and enhanced local accountability. So what were the wellbeing targets? The targets set for this programme was to improve the lives of 20,000 people across the southwest. These figures are too big to ignore. If the organisations had set about those tasks individually, we would not have such impressive big numbers that clearly demonstrate the impact. Its aim was really to work with the most isolated and disadvantaged people, that included families and people over 50s in particular. With 6 months still to go, this initiative has already achieved 25,000 people benefiting with lifestyle improvements. And through an external evaluation undertaken by the University of West of England, they were able to confirm that there were large enough significant levels of change to be worthwhile. In addition to its aims, the programmes facilitated shared learning, training that provides greater value through the consortium approach. Now, going back to the UE evaluation, the evaluation is now actually coming to an end, and those reports are being written as we speak. There's some samples of the evaluation of consortium working available for people to read, and the full report is going to be uploaded onto the website tomorrow, so if anyone's interested in looking at those outcomes, it's a good place to go. Some of the development points that influenced the outcomes and benefits were that the external evaluation highlighted several points. And some of those were that all partners were engaged in the bid development from the outset. They all produced individual proposals and plans so that when the single bid was submitted to Big Lottery, each partner knew exactly what their part was in there. They had complete ownership of the projects within the bid, and it made sense that they were going to be delivering the right services to the people that they worked with. Early introduction of monitoring processes ensured that effective planning for data collection from the outset was in place, so that everybody knew what they needed to collect before they started. And the external evaluation was also engaged from the outset. Again, early warning of required data collection made it easier for those organisations to actually embed that within their existing systems. And of course, clear financial plans were developed by each of those organisations separately, again within the bid, so that everybody knew what they were working to as an individual organisation. So the benefits identified through external evaluation, I'm getting lost here now, were that there were meaningful outcomes. Collectively, the numbers we're talking about are absolutely massive and they can't be ignored. There was shared good practice, and many partners felt that they were part of a bigger picture. The single purpose management team meant that the partners could focus mainly on what they did well, and not worry too much about what was going to happen, relaying the stats and the figures back to the funders. and actually did very well to manage the whole of this programme actually below 8% of the costs. So I think as value for money goes, that it worked really well. And we were also able to plough an additional 2% back into those delivery partners by means of sharing promotion, sharing good practice, training and things like that. So what's our offer? Sorry, I've got myself lost here.
We've got about a minute now.
Okay, that's fine. Our offer is to build upon the learning from the wellbeing programme and to look at how we can really upskill some of our partners by sharing some of the toolkit resources, offering collective bid writing, presenting collective capacity and skills with commissioners and funders, and offering professional grant management. We will facilitate the evaluation and have partnerships with national consortiums so that those of us who are smaller are not left out. And through that we will have access to large government contracts. So what are Well UK's strengths and its true value? Well, they can only really be measured by the sum of its parts. We are better together, we are stronger together, and we do achieve more together. Thank you.
Thank you very much, Jane, and thank you very much for a very clear demonstration and evidencing of the value of working in consortia and in partnership, which I think will have lessons in all sorts of fields, not just in the health and care sector. I'm afraid we are going to, we haven't got time for questions in this session, but I know our speakers are around for a while, so I'm sure they'll be prepared to be collared. I just wanted to say, Jane referred to the Future Jobs Fund, and I'm pleased to say that we recruited a colleague through the Well UK Future Jobs Fund, and we have recently been able to offer him a full-time position, and I'm really delighted to say he's been and is a very, very valuable member of the South West Forum team, has been and has played and is playing a major part in the organisation of this conference.